All right, welcome everyone. I'm so glad you all could be here at the public health briefing on housing solutions. We want everybody to be here today to learn about ways to support and strengthen public health and housing solutions in Colorado. My name is Mariana Huerta, and I'm the Housing Justice Project Director with Human Impact Partners, a national organization that transforms the field of public health to center equity and builds collective power with social justice movements. Today, we will hear from Gretchen Armijo, founder and CEO of Equity Policy Solutions, LLC, and Alex Georgiadis, policy analyst with United for a New Economy and Colorado Homes for All. And here's some brief framing remarks from me. Our goal is to explore key solutions to address the housing crisis, describe actions that the public health community can take, and share about opportunities to support community-led housing initiatives. We hope to provide food for thought, spark curiosity, and also engage with you in a rich discussion during our question and answer session after the presentation. We want folks to participate and really share their thinking, their questions, and what their learnings are. We're going to be recording today's workshop, so we started the recording already, and we'll share the video recording along with the presentation slides with everyone soon. So to get us started, I wanted to provide a few brief framing for today's workshop. The housing crisis requires public health action. I'll say that again. The housing crisis requires public health action. There's extensive, compelling evidence that shows the devastating impacts that housing instability, eviction, and becoming unhoused has on mental, physical, and community health, including high blood pressure, depression, anxiety, and psychological distress, substance abuse, hospitalization, and frequent emergency use. Uninhabitable and unhealthy housing conditions contribute to acute and chronic health problems. For example, the presence of pests and mold can cause or exacerbate respiratory conditions like asthma, and exposure to lead through deteriorating lead-based paint, lead dust, or lead in water can cause harms to children's brains and nervous systems. The public health sector has not yet leveraged our collective influence in the housing policy realm. There's an urgent need for policy solutions to address Colorado's housing crisis and profound health effects. Some of you are here today because you are ready to support housing justice solutions. Others are just starting to get familiar with this issue. We're glad that you came to learn with us, and we hope that you will leave today with helpful information to help support your work in health and housing. Next slide. So just briefly, I wanted to touch on a couple things regarding solutions to housing and also what our actions at public health can take. And then I'll turn it over to my colleagues to share more opportunities. One framework for advancing housing justice is the 5 Ps of housing stability. We call them, protection, preservation, power, production, and placement. But advancing each of these strategies simultaneously is the only way that we can move closer to housing stability and housing justice for everyone. We believe that the public health community's efforts to support the housing justice movement must be transformational and address the root causes of housing injustices and not merely add a temporary solution to the problem. Downstream solutions like housing vouchers, landlord subsidies, and services for the unhoused are important. We recognize that, but they are not enough at times. We need upstream solutions that will address the root causes of the housing crisis. So preserving and producing more housing is very critical, but it must be equitable and should not create displacement for families. And the reality is that we can't simply build our way out of a housing crisis or focus on market-driven solutions that are not always accessible to low-income families. We need strong protections for tenants, including for-cause eviction protections, which we'll hear about more soon, healthy and habitable housing, the right to legal counsel for when facing eviction, and other renter protections to really make sure that we are improving public health outcomes. And also power, right? I think this is a key solution. Shifting power and building the power of community residents is vital to improving housing and advancing health equity. Next slide, please. And, I'm sure we're all asking ourselves, what can public health professionals and leaders do to support housing justice initiatives? I'm here to tell you that there's a lot of great tools and opportunities and actions that public health can take as a person working with a local public health agency, or if you work with a nonprofit health organization, there's many opportunities for folks to engage. And so we have a menu of a few actions. Public health community can utilize health data to highlight health impacts, the impacts of housing instability and unhealthy housing on health. And in some cases, and we see this happening more often, public health leaders can give testimony at public hearings or hold meetings with legislators in support of housing policies. So there are opportunities for public health to support policies that are being introduced at the state or local level. Next slide, please. They can make grants available to community organizations or groups working at the intersection of health and housing, and also build strong, trusting partnerships with community organizations and broker governmental relationships. Next slide, please. Public health agencies have regulatory power and can support housing movements by strengthening healthy housing programs and hold landlords accountable. These are just a few examples of tools and action steps that the public health sector can take. We'll hear more from our speakers on opportunities for building partnerships and supporting health and housing initiatives. So I'm now going to turn it over to Gretchen Armijo to share with us about the opportunities for public health engagement in housing. So turning it over to you, Gretchen.
Thank you, Mariana, and thank you everyone for being here today. It looks like we have a great group from all over. I am a public health professional and an urban planner, and I want to share with you today kind of some level setting and shared definitions. Some of you, this may be elementary to you, but I just want to make sure we all kind of have a shared understanding of the relationship between housing and health, and then share a few examples of how I've been able to be at the table as public health in some of the housing sectors, and share that with you today. So next slide, please. So social determinants of health, as many of you know, the conditions in which we are born, we grow, we work, we live, we worship, and we age. And so these are 5 different sectors of how our lives are shaped and our health is shaped by these different sectors in our lives. And so housing is within the neighborhood and built environment, and that's what I'd like to show on the next slide. Within neighborhood and built environments, it's not just adequate housing, but our transportation options, whether we have access to healthy food, childcare, whether we have easy access to parks and green space and communing with nature, whether our neighborhoods are safe. Can we get the basic necessities we need within our neighborhoods? Do we have clean air and clean water? And also, is our neighborhood and community climate resilient? And these are all parts of the factors, the kind of world that shapes our health within our neighborhoods. Next slide. And actually, these social determinants of health have a huge impact, much more than just access to clinical care or our genetic makeup. They shape anywhere from 50 to 80% of our health, not only our physical environment, but the social and economic forces. And then also our healthy behaviors are shaped by, for example, whether we have access to healthy food, whether we have access to physical activity, to manage our everyday health. So they really have a much bigger impact than many people may realize. Next slide. So the links between housing and health are many, and there are 4 major pathways that we can group health impact from housing on, and those would be quality, affordability, community, and location. And some of the impacts, for example, in quality, there would be, pests and mold, which could lead to vector-borne disease, exposure to lead or radon or carbon monoxide, and then impacts such as asthma, cancer exposure, cardiovascular disease, or poor mental health leading from poor quality housing. In affordability, certainly there's stress from not being able to afford decent housing, and then the mental health impacts of that and the stress, as well as things like not being able to, having to choose between paying for your housing and paying for your medication or your utilities or other costs, and that can really directly impact health outcomes. In terms of the community, it's what kind of neighborhood is the housing in? Are you is there concentrated poverty? Is there segregation? Is there access to parks and recreation? Is it safe? Or are you worried about violence and crime? And does that increase stress? And are you in a neighborhood with quality schools or not? And that certainly has been shown to affect school performance, as well as things like civic engagement. Do you feel civic agency to be involved in your community? So that has a big impact. And then finally, housing location. One more. Do you have easy access to transportation, parks, schools, good jobs, medical care? And so those directly can impact as well your ability to live a healthy lifestyle, both physically and mentally. The next slide. So in this slide, it kind of shows the different impacts on health from each of these sectors within a healthy community. So you can see everything from the workplace and jobs to schools, transportation, and the environmental quality all have different impacts on health. And what I wanted to point out on this slide is that housing and let's see, there's the schools actually impact all 6 of the health and equity benefits shown in this slide. So housing really is absolutely critical for everything from our physical and mental health to our economic security, safety, community cohesion, and civic engagement. So really a key element to our health. Next slide. So there are a number of pathways for public health to partner with planners in particular that shape so much of our housing and our built environment through zoning and master planning and site planning. And I want to share a few of those examples next of different pathways that I've used, and then kind of summarize opportunities for public health to be at the table. Next slide. So one aspect, and I've worked in state health departments, City of Denver Health Department, and then now I'm a private consultant working as a public health professional, connecting health to built environment. So at the City of Denver, I worked as the public health staff person on Blueprint Denver, which is the 20-year land use and transportation plan. And many municipalities have these sorts of comprehensive vision plans. For the first time at the City of Denver, Public Health had a seat on the city's staff team. So along with transportation, along with parks, along with economic development, we had Public Health on the city staff team. And this was a 3-year long vision plan, which most of these big comprehensive plans are multi-year processes. We were able to actually incorporate health and equity data into the plan. So sharing the health data and equity metrics with all of these other stakeholders and really educate the stakeholders about the role of health equity and also racial equity in land use development. And this was the first time that equity had been explicitly included in a City of Denver plan. So we were really proud of that work. Next slide. Another project that I'm actually working on now with an affordable housing developer is to help bring data expertise, the public health data, to housing plans that typically would not be in there. So for example, I analyzed the community health needs assessment that all hospital systems have to do as a regulatory requirement. And in this particular case, in the city of Denver, a couple years ago, SCL Health did their CHNA, and housing was a top priority. So being able to pull that in to educate stakeholders that this is the hospitals identifying housing as a key health need and a key health impact. And then sharing data such as asthma hospitalization, we could really zoom in on the neighborhood we were working in and say, hey, this is higher than the state average. We really need to consider designing housing in such a way that can help reduce this health impact. And then another example on the next slide. I conducted a health action plan, and some of you may have heard of health action plans. They're similar to health impact assessment. It's a streamlined version, particularly for affordable housing developers. And we conducted it in partnership with the developer, the public health department, in this case, El Paso County Public Health Department, the city of Colorado Springs, and convened a range of service providers to look at developing a senior affordable housing community in the Springs. And the advantage of having public health at the table was that we were able to identify a lot of evidence-based strategies to inform not only the design of the project with the architects, but also the programming and ongoing operations of senior affordable housing. And in this case, on the next slide, the developer shared at the end that having this resource provided a way for us to share a vision of how we're working with community to create healthier housing. And it actually spurred some new conversations with new healthcare partners, such as, in that case, the School of Nursing was interested in doing weekly vision and hearing screening clinics at the new senior affordable housing complex. So that was a great new partnership that was a result of public health being at the table. So next slide. So in conclusion, I think that there are a range of these ways to partner, as this one infographic shows. Public health can be an advocate and build capacity in other sectors to advocate for health and health equity. It really normalizes the conversation with public health being at the table. Talking about health, talking about equity, talking about racial equity is something that planners maybe normally don't do, but this is a great way to start to normalize that. Getting outside of your own sector and being at the table of other sectors to really engage in that conversation. Education is a huge piece. As a public health partner, we can make ourselves available. I have done different lunch and learns for different city or county departments to learn what is health, what is equity, what kinds of data can your public health department provide for you, testifying at public hearings if that's helpful. And then, public health are the data and evaluation experts. We have all kinds of amazing data that people often don't know we have. And we can help evaluate how projects or plans have impacted health afterwards. And also, as Mariana showed on one of the first slides, applying for joint funding, that's always great when you can bring money to the table or the promise of partnership to help apply for funding. And a lot of this health data can help applications for funding for land use and housing projects. So I think that might be my last slide. One more. Yes, so anyway, I am a big advocate for public health partnering with other sectors, and I'm eager to learn more from our other partners here today. So thank you.
Thank you so much, Gretchen. That was really, really rich and wonderful information. Yeah, I really appreciated you naming all the partnerships that you've worked with and brought together, including with governmental agencies and with private developers and with community groups. So it's really great to see the different pathways, the different avenues. I did want to kind of note that it doesn't take a requirement to have an urban planning background, right? I think a lot of this work, does really touch on the built environment and housing, but there's so many opportunities for folks in different parts of public health, including in maternal and child health, in substance abuse, in the different divisions of health, to really see the connections with health and housing. So just wanted to kind of name that, there's so many good intersections between the issues that we work with in our public health agencies and housing. So, keep that in mind as we're kind of discussing together today. And we look forward to more questions going forward. So now I'll turn it over to Alex, who's going to share a little bit more about some current opportunities to partner with community groups and the folks leading housing work at the state level. So turning it over to you, Alex.
Hi, everyone. Thanks for being here. My name is Alex Georgiadis. I use she or they pronouns, and I am the policy analyst at United for a New Economy based in Adams County, which is part of the Colorado Homes for All Coalition. Just a little background about our organization before I jump into my slides. United for a New Economy is a grassroots community organization that builds people power to advocate for racial and economic justice. And we currently organize in 3 different cities in Adams County, which include Westminster, Commerce City, and Aurora. So I'm going to be spending some time talking about the current housing landscape in Colorado and the lack of tenant protections, and then spend some time focusing on a bill that we're supporting that was just introduced in the House at the state legislature this week, for cause evictions, HB 24-1098, and how it will help protect the health of renters in our communities. So currently in Colorado, our state statutes generally favor landlords over tenants in terms of the rights and protections that are given to each group. So some of these examples include there's no legal limit on security deposits. Landlords can charge as much as they want for that. There's no legal limit on annual rent increases. There are minimal to no licensing requirements for rental properties, with the exception of a handful of cities like Denver and Boulder. And there's minimal notice time for evictions, especially for non-payment of rent. And the biggest one that our bill is trying to address is that there's currently no for-cause requirement for eviction, which means that landlords can choose to not renew a tenant's lease without any cause at all. And as I'll share throughout the presentation, that has harmful implications for renters, especially for renters who are low income and people of color. Next slide, please. So there's a number of impacts of the lack of eviction protections on tenants, but I'm going to spend some time explaining how this plays out in 3 specific ways with some examples from our community members. So one impact of the lack of eviction protections, and the one that we most commonly see with our community members, is retaliation by landlords who are trying to advocate for repairs in their apartments. So we've had countless members try to get their landlords to fix code violations in their apartments, ranging from mold, cockroach infestations, broken pipes, non-functioning heat. And oftentimes the landlords ignore the tenants' requests for repairs, forcing our members to go ahead and file complaints with city code enforcement. And we've had multiple instances of, after our members filing complaints, they discover that when their lease is up for renewal, that the landlord just chooses to not renew their lease because the city got involved with the property. And because our current laws don't require cause for non-renewal, this form of retaliation is technically legal. And that puts many of our members out on the streets or looking for new housing at that point, scrambling to try and find stable housing. Another impact of the lack of eviction protections is that it can lead to discrimination. And again, because the law doesn't require cause, many of our members who are Latinx and Black have experienced discrimination from their landlords. For example, one of our members who lives in Westminster experienced multiple instances of discrimination with her landlord, such as being called racial slurs when she tried to ask the landlord to fix code violations. And then when she tried to advocate for herself by reporting the instance to the Attorney General's office, she received a notice of non-renewal from her landlord. And even when the individual got an attorney through a legal aid group and fought the non-renewal in court and described the instances of racial bias, the judge sided with the landlord because the landlord didn't need to have cause to not renew the tenant's lease, opening the door up to a legal form of discrimination. And a third impact that I want to highlight is overall housing instability. So when tenants don't know if they're going to be able to renew their lease, tenants end up moving unexpectedly, paying additional moving costs that they weren't planning on or saving for, having their kids change schools. And for tenants who don't have enough extra funding to afford a new security deposit or find adequate affordable housing, this can open up the door to them living in substandard conditions with poor housing and health conditions, or opening up the door to first-time homelessness. Next slide, please. Now I want to spend some time outlining what a for-cause eviction law is and what it would do. So for cause, which can also sometimes be called just cause eviction or good cause eviction, basically outlines all of the allowable reasons for eviction and non-renewal. So what this means is that the landlord must have an allowable cause in order to evict or not renew the tenant's lease. And otherwise, if they violate the law, the tenant has the right of private action to contest it in court to stay housed. There are currently 5 states across the US that have for-cause eviction protections, and those are the states with the stars on them. So California, Oregon, Washington, New Jersey, and New Hampshire. And there's also a handful of cities across the US that have additional for-cause eviction protections. Next slide, please. Now I'm going to talk through some of the details of the bill for this 2024 legislative session. So the bill would apply to most renters across Colorado, but there are a few key exemptions, and some of those would be owner-occupied buildings with less than 4 units would be exempt. So that's like a single-family home where the owner lives on the property, and that could include an ADU or not. Duplexes, triplexes, and multifamily buildings with less than 4 units where the owner lives on the property, those are exempt from the entire bill. Mobile homeowners are also exempt from the bill because they already have just cause protections in a separate law. And then renters who don't fall into those categories would be protected under this new law. So then the bill outlines the major allowable causes for eviction, and it divides it into 2 categories called for cause and no fault. For cause reasons are the reasons that already currently exist in state statute that are allowable reasons for eviction, like non-payment of rent, substantial violations, lease violations. And so those will be staying the same in statute with similar notice time, court procedures, and remedies. And then there's an additional category called no fault reasons. And so those would still be allowable reasons to not renew a tenant's lease, but they wouldn't count as an eviction on the tenant's record, and they would have a much longer notice time. We're currently in the bill draft, it's set at 90-day notice for these reasons, like demolishing the unit, the landlord or family member moving in, withdrawing from the rental market. And there's a possibility for relocation assistance under some of these no fault reasons as well. And the biggest benefit being it wouldn't go on the record of the tenant. Next slide, please. So that was some of the overview of the bill. There's definitely a lot more details that I'm happy to answer if folks have questions, but we have some amazing bill champions who are working really hard to get the support of their colleagues and get those passed into law. So our sponsors are currently Majority Leader Duran in the House, Representative Mabry, Senator Gonzalez, and Senator Hinrichsen. And the bill was just introduced in the House this past week, and its first committee hearing is going to be next Tuesday. I think that should say 1:30. That's my mistake. Next Tuesday, January 30th. It will be heard in committee. Next slide, please. Now I'd like to take some time to share a story of a community member who's experienced some really severe health impacts during the course of his eviction to make it more tangible of what we're talking about here. And as a note, he gave me permission to share this story with you all, and he's going to be sharing this story in the form of a testimony at the Capitol next week. So in May of last year, a group of tenants at an apartment complex in Aurora reached out to Denver 7 News to ask them to highlight the horrendous conditions that their complex was in and that their landlord was refusing to fix. So it was things like no working elevator, broken staircases, significant plumbing issues, issues with the foundation. And one of our community members, his name is also Alex. He's a 54-year-old man who's a renter in this complex, and he participated in getting the news to help cover it. And he currently lives with a range of health conditions, including asthma, type 2 diabetes, and he's legally blind in one eye. And some of the conditions he was facing in his apartment include his entire living room ceiling collapsed, forcing them to move him to another unit. But then when he went to the new unit, There was no working water, there was no central AC, there were leaking pipes, there were cockroaches, and there was a really bad mold problem. So after interacting with the news, Alex became energized by the idea of community organizing, and he joined our organization, United for a New Economy, to start to take action. And after the news segment aired, property managers started retaliating against all the tenants who'd participated in the news segment. So they tried to accuse Alex of non-payment of rent to get him evicted, which was a completely unfounded claim. He had been paying his rent on time and in full. And when that wasn't working, they started to physically intimidate him and follow him around the property. He kept going with his community organizing work, so he started to get the city of Aurora involved. He reached out to code enforcement to come out to inspect the property, and a group of tenants also got Mayor Kaufman of Aurora to walk through the property. And after that happened, Alex received a non-renewal notice so that he wouldn't be allowed to renew his lease in this property. So that he would have to leave. From the first time that the landlord tried to evict Alex to when he actually moved out, he experienced really severe psychological stress around even the threat of losing his housing and potentially becoming homeless. He was hospitalized 7 times over the course of several months. Some of those were for high blood pressure, diabetes complications, mold in his unit triggering asthma attacks, and just the stress of the possibility of losing his home exacerbating all of those existing health conditions. His partner, Jamie, who was previously healthy, also started developing respiratory issues and a lot of stress and anxiety. And then when he finally did have to move out, because technically his non-renewal was a legal eviction, he had significant challenges finding adequate housing because he needed housing that was close to his healthcare network and close to public transit because he can't drive because of his blindness. So that really limited the area that he could look for safe and affordable housing. Thankfully, Alex and Jamie were able to secure safe and affordable housing after this whole ordeal, but his story is just a drop in the bucket of tenant stories that we've encountered of landlords abusing the lack of tenant eviction protections and how it really impacts tenants' health and well-being. Next slide, please. I want to take a moment to highlight a few other bills that are addressing the connection between health and housing, so you all can have them on your radar. There's Senate Bill 24-094, Safe Housing for Residential Tenants, and you see the bill sponsors there. And this is revising some of the current warranty of habitability statutes by creating some more reasonable notice requirements for tenants, creating some presumptive timeframes for completing repairs and remediation, clarifying when they're entitled to lodging arrangements, and a few other details that I can share more about. And then there's another bill I wanted to highlight, House Bill 24-1007, which will prohibit localities from setting occupancy limits unless they're tied to health and safety standards. Next slide, please. And if you all are interested in becoming involved in passing for-cause eviction, here's a few ways that you can get involved. You can reach out to the elected officials in your district, either by email or phone call, and urge them to vote yes on the bill. You can write a letter to the editor of your local newspaper, and we're going to send out a way to do that by a document that gives some guidance on what you could include in that letter to the editor. And if you're getting really excited and you're like, I want to go to the Capitol and I want to testify on this, we'd love to have you come and testify, and we can get you connected to figure out how to make that happen. Next slide. And here's my contact info and my email. And then I also shared Misha White, who is our coalition manager. This is her email if you're interested in getting involved with the coalition. And that's my last slide, I believe.
Thank you so much, Alex. That was really great presentation and so informative. Yeah, just appreciate how you highlighted the really direct health impacts on members, which I know is just one of many stories. And just one thing I wanted to respond to is that, a lot of times we want to make sure that community residents are living in healthy, dignified, and habitable housing conditions, but without these protections, for cause eviction, without making sure that, renters are not seeing high rent increases, it doesn't matter they're going to have the best conditions in their homes, which we want that, but we need to also make sure that there's really strong protections for tenants to make sure that they can stay housed, that they're not going to face retaliation or harassment from their landlords or see rent increases the following years, extreme rent increases, that is. So just wanted to kind of name that as well. So now we have some time for questions. We'd love for this to be, an open discussion. If folks want to ask the speakers any questions or ask each other questions. So we invite anyone to either come off mute. I'm seeing a couple in the chat, which I'm happy to start sort of reading and then inviting our speakers to answer. So let's see, the first question I see, I'll just go ahead and start with the chat. Would renters, and I think there was one other one. Okay, would the bill still allow renters to inflate rent costs with no caps on increases? From Grace Franklin. Just to clarify, are we asking about landlords to inflate rent costs, or want to make sure that the question is...
Yeah, hi.
Hi.
I was wondering about landlords specifically, or property managers. I just wonder if that would be a workaround for them to actually get folks to leave with this bill intact. If they'd still be able to do that.
Mm-hmm. Great, thank you. Alex, do you want to take that question?
Yeah, the answer is unfortunately, yes, this bill doesn't address rent increases because of single subject rules. So that would have to be a separate bill. So, and that is a concern that we have, that landlords will then use raising rents as a way to essentially force non-payment of rent or have someone involuntarily move out because they can no longer afford the rent, which is why rent stabilization and for-cause eviction are most effective when they go together. And so that is another policy priority of Colorado Homes for All, is to eventually help support the passage of rent stabilization, but this for-cause eviction bill won't be able to address it this year.
Okay, thank you.
And I see one other, thank you so much for that question. I see another question that I think maybe Alex can answer. Would renters of mobile homes be included in protections from no-cause evictions?
They would not. Mobile homeowners are exempted from this bill, and they have a different bill that has already been passed a few years ago, I believe, that has certain protections around evictions. So I'm not.
Is that specific to renters, though, if they don't own the mobile home, if they're a renter of the mobile home and the owner is the landlord?
If they're a renter of the mobile home, then the bill applies. But if they own the home and are just renting the lot, then they're exempt. Does that make sense? Yeah.
Thank you. All right, another question, and we'll go through the ones in the chat, and then feel free to raise your hand or come off mute to ask questions. So, okay, it says, I saw that having a family member move in with you is not a cause to evict. Is there a cap on how many family members can move in before it is not okay? Is there a definition of a family member?
Yeah, good question. I love all the excitement around this bill. Yes, so family member is defined as the landlord's spouse, domestic partner, child, stepchild, parent, step-parent, grandparent, or grandchild. So if the landlord wanted one of those members to move into the unit, then that would be an allowable cause. I'm trying to think if there's any other, and it would have to be for that person, that family member's primary occupancy. So it can't be like their second place to live. And also, I'll just add that the bill is currently live on the Ledge website, so you all are able to look up the bill text if you're curious.
Thank you. Another question from the chat. Does spouse have to be legal, married? For example, married.
That's a good question. I'm not totally sure how spouse is defined in statute. be something to look into.
Thank you. All right. I now want to, invite anybody who wants to raise their hand and ask a question. I see more coming in the chat, so I'm happy to read those, or folks just want to come off mute or raise their hand to ask the question. That's also good. I'll go ahead and read the next question. Could you share what some of the tension points in this bill will be, and what health points may be helpful for countering opposition?
Yeah, so the primary tension point right now is with landlord lobbying groups like the Colorado Apartment Association, who pretty much oppose any amount of protections on tenants that they interpret as restrictions on how they conduct business. So that's what we anticipate to be the main opposition, just that they want to be able to get rid of tenants when they want to without any restrictions at all. And that affects their bottom line, basically, if there are restrictions. And I think this idea of connecting health and housing is still pretty new for a lot of legislators, and there are a lot of legislators who are passionate about protecting community health and well-being. And so I think the more that we can help make that connection for legislators, the more they'll start to see it in a new light, that, oh, this isn't just about housing. This is when folks are evicted from their homes, it's having really detrimental impacts on their health. So it doesn't even need to get a whole lot more specific than that, just to be able to point out that these two things are deeply intertwined.
Thank you. Another question, any early conversations with CCRD regarding enforcement when these violations intersect with fair housing violations? Alex or Gretchen, if you feel like you want to touch on this.
I'm sorry, I don't know what CCRD is.
The Colorado Civil Rights Division.
Oh, okay. So fair housing laws actually, from what I understand, only apply to access to housing and discrimination around getting into housing, but don't apply around evictions and exiting housing is where the big loophole is what we're finding.
I would just challenge that and put a peg in this, Alex. I've been in that space for many, many years, and a lot of the complaints do come from renters. And I'm thinking about how many bills we often see that are like very supportive in their verbiage, but don't have any actual enforcement. And I'm also thinking about the kind of unstable funding that CCRD receives. Sometimes they are able to take a lot of discrimination cases and sometimes not as many around fair housing, just based on, funding and staffing. And I wonder if this is an opportunity to kind of leverage that support and that collaboration so that we can actually get some enforcement behind this eviction bill, which often intersects with the discrimination, the 7 protected classes under the Fair Housing Act.
Okay, yeah, thank you so much for pointing that out. That's definitely something worth looking into.
Yeah, thank you for that thought, because I think it is really important to keep that in mind. Great. We have a few more minutes for questions if anybody wants to jump in or add to the conversation.
I was
Yeah,
going to
I see.
ask Alex. Oh, sorry, this is Gretchen. I would be interested in your suggestion of contacting my elected representatives to support this bill. Do you have some template language or a template letter or some key talking points that we could include in there that would help, increase support for the bill?
Yes, we do have some language, and we can send that out in a follow-up email to all the participants. That's a great idea. Thank you.
And then if HIP has also, or Alex, if you have any in particular health talking points about linking it to health, I would hope that might be effective as well. I'd be interested in doing
Yeah,
thank you.
that's a really good thought.
Yes, I also love that suggestion, and we're happy to share resources that we have, including a narrative toolkit that we often share with public health community to help background and some messaging. I see another hand raised. Megan, if you want to go ahead and come off mute.
Hi, thanks, Mariana, and thanks, Alex. I just wanted to sort of underscore that point of the importance um, of health, bringing the health perspective in. So I used to work at the San Francisco Health Department, and we, at that time, they were doing paid sick leave. And during that time, the majority of the debate was around the economic impact that was going to be happening to employers if you paid sick leave. And the introduction of the health perspective really shifted the debate from it being like an economic issue to a health issue, and the importance of protecting workers, protecting consumers, et cetera. And I think health professionals can play a similarly important role in this debate about really emphasizing the importance of the health impacts on families and communities when you are able to stay in your apartment. And so just want to put a plus 10 or plus 100 to like all of us who identify as health professionals in Colorado being able to use those talking points that Mariana will be forwarding as we're communicating with our legislators about the importance of health and housing.
Thank you so much. Yeah, I think it's been, in my experience, such a game changer when public health chimes in and shares expertise, data, and just really lifting the frame of housing and health, right? It's one of those situations where like elected officials and legislators kind of pay attention more when public health is saying it, right? It shouldn't be that way. We really should be taking community stories and the work that community groups have been doing for so long about housing and protections for tenants for their word, but that doesn't always happen. But when public health or the health sector community is really lifting up that language and really sharing that expertise, it changes the situation, and elected officials start paying attention, and it really helps lift the work and leverage that power. So absolutely echo what Megan shared, and the kind of connections we're making today. Yeah, I'll allow, if there's any last questions where we can continue asking questions. Did you want to add something, Alex? Yeah.
Yes, I just wanted to add, I put a link in the chat that is to a petition in support of this bill. And so if you are interested in filling it out and you put in your address, either of your workplace or of your home address, I guess whichever one feels more relevant for you, then it will automatically send an email to the legislators in your district saying that you're in support of the policy.
Mm-hmm. Great. I have a question for the group if there's no other questions for us. And I'd love to sort of, engage in a dialogue and conversation with everyone, but I'd just love to hear from you all as, public health professionals and public health leaders. What are the things that you need, the tools, the training, or the information that you need to do this work, right? We just had a conversation about the different opportunities for partnering with housing organizations or with governmental agencies or planning departments. What do you need to be able to do this work going forward? I'd love to see if there's anybody that wants to share out some ideas.
I would say like pamphlets and that kind of stuff that shows kind of like what tenants have, or what landlords have to do, what tenants have to do if leases trump certain things. Just the other day, we had a call come in to our public health office, and it was a tenant complaining about stuff, but also we didn't know if it was hearsay or what actually happened. And being able to have like facts of like, this is what you can do or cannot do would be really, really helpful.
That's great. Thank you. Yeah, so more materials, resources. I see Dee Dee's hand raised. Feel free to go on.
Yeah, hi. To that last question, if it's helpful, there's a website, www.fixmyrental.com, I think it's .org, that I think it's the Colorado Poverty Law Center put together, and it's both for landlords and tenants, and it outlines the responsibilities and actions that both landlords and tenants can take. So it's actually a really great resource, because if your heat goes out, it's like, this is what the landlord has to do, and this is how fast they have to do it. And if they don't fix it, this is how you can move out and not get charged. So it's actually a great resource and a great place to start for renters and landlords.
Mhm. Thank you. Really appreciate that resource. And I see we added it to the chat.
Thank you. I didn't know that was available. That's awesome.
Wonderful. Any other thoughts on what support, what you need to be able to do this work? Any additional learnings that you would want to do? You know, I think this is a first conversation, but we're open to doing more conversations, bringing in folks within local public health agencies or state public health agencies to kind of share what opportunities or technical assistance is available to share with staff and departments. So that's one opportunity, but we'd love to hear what other needs or support would be helpful for everyone. And I see Joan raise her hand.
Yeah, thank you. Can you hear me okay?
Yes.
Perfect. I'm on the move, so I just wanted to check. This has been super helpful, and I think for us as a local public health agency, we just finished our public health improvement plan, and the number one priority was burden related to cost of living. In Eagle County, that's a huge part of what our community members are dealing with. And I think just having the education around what rights look like and then how they might shift, which I know we talked about today, and just having continued update on that. I know we have a lot of renters who they don't even feel like they can make some type of complaint when they are dealing with really unsafe housing situations because there is no other housing available. So they would rather live in the unsafe housing situations that they're in than be unhoused because our housing inventory is so low. So I think continued education and updates on the rights so that we can share those with our community members in the partnerships we do have, so they can feel more secure, honestly, in their ability to advocate for what they need.
Thank you. That's a really, really great suggestion. And definitely something that we can do and want to do, right? Continue bringing updates and information and opportunities where there can be partnerships with public health and housing groups. I see some comments in the chat that I'll go ahead and read out. So there's folks in a newer health department in the county. We are enhancing partnerships and expertise with municipal and county partners in code enforcement, zoning, planning, and housing. So love the idea of pursuing joint funding opportunities to strengthen this. So that's great. I love that you guys are thinking about opportunities for joint funding. And I see another idea for what could support having an action hour or time to get together to think about and maybe practice some of these talking points. Personalized letters to legislators, and engaging with communities. So yeah, I love that idea. Any last thoughts before we start wrapping up? All right.
This is Dee Dee again. I'll turn on my thing. One thing that I've thought about for a long time, but just haven't had the bandwidth for, is actually developing a listserv or a group of progressive landlords. I'm a landlord. I have one unit. I've testified at state and local levels on behalf of renters' rights. And I feel like I have not a lot, but probably half dozen to 10 friends, right, who also are like single landlords. I hate the word landlord, but single landlords, right? They're renting a house that they used to live in or a smaller house. And I just think starting to create that network to push back on the apartment association, who like always misrepresent the information because they don't actually represent most of the apartments and houses in the state. So that's just an idea, and I don't know who has the bandwidth, but just throwing that out there.
I love that idea. Alex, do you want to respond to that?
Just gonna add that I love that idea too, and we definitely have been trying to figure out how to incorporate small landlords who actually support our policies into testimonies and start giving them more of a public face, because otherwise, yeah, the apartment association totally co-ops the narrative and tries to speak on behalf of all landlords when that's not how all landlords feel about a lot of these policies.
Yeah,
So.
and having like a name or a presence, because when I've tried to push back with like Colorado Public Radio and being like, again, the apartment association, not good representation, that's just like my voice telling them they're wrong. And I feel like it doesn't get a lot of traction. But if there was a group that even had like a name, right, I feel like they pay more attention when they got that pushback.
Yeah, this is a good organizing opportunity.
That sounds great.
To think about it. Yeah. Thanks for sharing.
Great. Well, thank you all so much. I wanted to just, reiterate the opportunity and really the need for public health to support this housing work. As Alex mentioned, there is a hearing next Tuesday for the for-cause eviction bill. So if you feel energized to support that, there's opportunities for you today or this, in the next week or so to support that work, including, reaching out to your legislator, submitting a letter to the editor, which I believe Alex will be sharing a few templates or some resources for that. And also, getting letters to your legislators or any ways that you think you can support as a person or as a staff member within your organization or agency. So we encourage folks to engage, and we hope you stay in touch. I'll invite Gretchen and Alex to add their emails in the chat. I mean, we shared them on the screen earlier, but just, final time adding emails, I'll add mine as well. We hope you will reach out and contact us. We want to continue supporting, collaborating, and really being a resource for everyone to do this kind of work going forward. So just again, want to really thank everyone for your energy and your engagement today and for joining us. So appreciate that. Have a good rest of your day. I'll add my email. Thank you so much, everyone. We hope to see you again soon, and this will be one of many conversations, hopefully. Thank you.